Salivary gland lesions. Pleomorphic adenoma. Pleomorphic adenoma is the most common benign tumor of the salivary gland, and it is also called as mixed tumors because it is characterized by an admixture of epithelial and stromal elements. Pleomorphic means nuclear variation in neoplasm, which means the variation in size and shape of the nuclei. The pleomorphic adenoma usually occurs during third to fifth decade of life, that is between 30 to 50 years of age in the middle-aged persons, and this pleomorphic adenoma is most frequently seen in females. Site of pleomorphic adenoma. Major salivary gland is the common site, and it constitutes about 60% of tumors in the parotid, which usually arises in the superficial lobe of the parotid, and it is less common in submandibular gland and a very rare in sublingual gland. And regarding minor salivary gland, the involvement of minor salivary gland in pleomorphic adenoma is relatively rare when compared to major salivary gland. Regarding the etiology of pleomorphic adenoma, it is still not known, but exposure to radiation increases the risk. The pleomorphic adenoma is a benign tumor and its histogenesis is uncertain. It was called as mixed tumor because of the mixture of epithelial and mesenchymal components, but however now it is considered that the tumor neoplastic cells are of either myoepithelial or ductal reserve cell origin. And regarding the gross morphology of pleomorphic adenoma, it is round shaped and its size ranges from 2.5 to 6 centimeters in diameter. The consistency depends on the relative amount of epithelial cells in stroma, and the consistency of pleomorphic adenoma is usually rubbery, resilient mass with a bosselated surface, and it is well circumscribed and capsulated. In some, the capsule is not fully developed and small extensions can be seen protruding into the surrounding salivary gland. This makes enucleation of the tumor difficult. The cut surface shows gray-white with myxoid and blue glistening translucent chondroid. So this picture is the cut section of pleomorphic adenoma of salivary gland. It shows well circumscribed gray-white tumor with a blue glistening area. Regarding the microscopy of pleomorphic adenoma, the characteristic feature is the pleomorphic appearance. The neoplastic cells show varying mixture of epithelial tissue component intermingled with the cells showing mesenchymal differentiation. Microscopically, epithelial element and mesenchymal like elements both are seen. So the epithelial element consists of ductal cells and myoepithelial cells. The epithelial elements are arranged in the form of ducts, acini, and irregular tubules. The ducts are lined by both epithelial cells and surrounded by myoepithelial components. It may show strands or sheets of plasmacytoid or spindled myoepithelial cells, and it consists of islands of well-differentiated squamous epithelium. Mesenchymal-like elements are the epithelial elements which are dispersed within a varying amount of mesenchymal-like background of loose myxoid tissue, islands of hyaline, chondroid, and mucoid matrix. So this picture shows the pleomorphic adenoma of the parotid gland. This is the histology of pleomorphic adenoma stained with hematoxylin eosin. And this picture is the diagrammatic representation of pleomorphic adenoma. It shows the epithelial cells forming ducts surrounded by myxoid mucosa. It is seen in this picture. In histology picture also, it is seen that the epithelial cells form ducts surrounded by myxoid stroma and the cartilaginous differentiation. So regarding the clinical features of pleomorphic adenoma, it presents as painless, slow-growing, mobile, discrete tumors in the parotid or submandibular areas or in the buccal cavity, and these tumors tend to protrude focally from the main tumor into the adjacent tissues, and the failure to recognize these minute protrusions at surgery is responsible for the recurrence of these tumors. Carcinoma ex pleomorphic adenoma means a carcinoma may arise in pleomorphic adenoma. This is called as carcinoma ex pleomorphic adenoma. It is also a malignant mixed tumor. The incidence of carcinoma increases with the duration of the tumor in case of carcinoma ex pleomorphic adenoma. And regarding the microscopy of carcinoma ex pleomorphic adenoma, these tumors show poorly differentiated adenocarcinoma or undifferentiated carcinoma in an otherwise benign pleomorphic adenoma. So to summarize, pleomorphic adenoma is the most common benign tumor of the salivary gland. The pleomorphic adenoma is the most common tumor of major salivary gland, mainly parotid, and less common in submandibular and sublingual gland, and it is very rare in minor glands. Pleomorphic adenoma is a benign salivary gland tumor composed of a mixture of epithelial components and mesenchymal-like components. In a significant number of these tumors, there is chromosomal rearrangements involving PLAG1, PLAG1. It is a gene encoding a transcription factor. This PLAG1 upregulates the expression of many genes which increases cell growth. Example, growth factor receptor signaling pathways. Next is pleomorphic adenoma, and the most common site of pleomorphic adenoma is the parotid tail, in the superficial lobe of the parotid tail. The pleomorphic adenoma is encapsulated, but pseudopodia projects to the surrounding gland. Pseudopodia means finger-like projections. So they will protrude to the surrounding gland and it is encapsulated. That is what is pleomorphic adenoma, and it is a slow growing tumor. It is unicentric, but recurrences are multicentric.